So nothing gives me more pleasure, ladies and gentlemen, in presenting to you this extraordinary, humane doctor and politician, His Excellency Dr. Lote Shering, the Honorable Prime Minister of Bhutan. Thanks very much, sir.
Good evening to all my surgeon friends. In fact, I've been waiting for this time to come, and as Dr. Raghu rightly said, nothing will take me off from anything doing with surgical or anything that has to do with medicine. Dr. Raghu is right that today is the eve of our 113th National Day. So for that, actually, I'm out of the capital. We are preparing to celebrate the National Day in our old capital of the country. So by that, I'm out of the capital, but yet I wanted to be really physically present, though virtual, but I want to be physically present and go through all the discourse that you have been going through until now. I've listened to every speaker until now, and it gave me immense pleasure because I feel that I'm with my family members of surgical fraternity. So I would like to thank all of you for having me today. Going by the discourse, going by the citations that I just heard, I really doubt if I can add any value to the gathering here, the gathering of young and bright minds. But yet, I also would like to join the crowd to congratulate all the recipients here, the 3 outstanding surgeons who received lifetime awards, 6 surgeons who received honorary fellowship from outside India, and of course, our 57 young upcoming Indian surgeons who received the fellowship. I'm sure they are so very happy today that they are inducted in this August association. And as Dr. Raghu said everything about me, I think that is where my passion lies. And as a human being, I personally strongly believe that we all must have passion in life. And my passion is surgery. And because of my passion in surgery, it took me to politics. As Dr. Raghu rightly said, I really wanted to examine the health of the policies, the health of governance. And as you all would have talked about, as you all would have actually complained about, the politicians, I also did a couple of years back. So then I thought maybe we must not just complain, but try it ourselves first. And then that gave me the opportunity to join my friend, rather, a pediatrician who formed the party that is in governance now. And then he and me, we did our medical graduation together, and he took up politics and he formed this party. He wanted me to join. I joined, and now we are in governance. Our foreign minister, by the way, is Dr. Tandi, and he has his MD from AFMC Pune. He's a practicing pediatrician and now the foreign minister. To give you that, the reason for giving you that is we strongly believe in evidence. As you all know, the only point that I can think of sharing with you all today is my talking points with the residents. When I take the grand rounds on Thursdays, when I spend Saturdays, Sundays with my residents, I always want to spend some time talking to them what should we be doing as a professional body. And one of my main points to my residents is, I know they have joined the surgical department to be a surgeon one fine day. And that I always tell them that is never my worry. Whoever joins the department will go on to be a surgeon one fine day. But my main responsibility is to make them good surgeons. And when I say good surgeons, I don't mean by skills, by the way. We all have the natural aptitude to be good, skillful surgeons. When I say good surgeons, I want them to be good human beings first. Without that person being a good human being, he or she can never be a good surgeon. So that being my talking line to all my residents, I always tell them that for us, it is very, very easy to be good human beings because we have 2 criteria, 2 basic principles that we have already come across. That is the principles of Hippocratic Oath that we have taken. The principles of Hippocratic Oath, as you all know, simply says do no harm. Keeping that in mind, not doing harm to anyone in mind, We are evidence seeking professionals. For whatever we do, we need evidence. We need a clear answer on whys and the hows. If we have the answers on whys and the hows, then only we want to do it. And that is what we call as evidence. So with these two basic principles of not harming anyone and the evidence-seeking personalities that we all have, if we practice it well, I am very sure that we all can be good human beings first. So with this, I have always practicing my profession with these basic principles in mind. While we were doing this, as we all know, we tend to have disagreements with the policymakers. We tend to have disagreements with people in power, so-called politicians. We really wanted to try and see if the politicians will have to really behave the way they are doing. So that took me to politics a couple of years back, and by the grace of God and a well understanding of our Bhutanese people, they gave us the chance to govern the country, and we are doing it so now. While we are governing, my principle again is very simple. As a surgeon, I had been operating with my surgical scalpel as you all did or you all are doing now. Now in governance, I operate with the pen. I'm still operating, by the way, as Dr. Raghu rightly said. But instead of operating with the scalpel, now I'm operating with the pen on the principles of governance, on the policies. And to share with my surgical friends that if we had been following our surgical principles and ethics of being a professional body very, very strictly, governance is far, far easier. To me, I find governance very easy because the most difficult thing that we all have to follow is doing it right, not taking advantage of the authority that you have or that is given to you. And as a very trained mind, if we have control over that, then everything else becomes very easy. I always believed when I practice, or rather I still practice, or when I teach my residents, that ours is a teamwork. But when I say teamwork, I just don't mean the technicians and the nurses and the anesthesia team that is working with us. I very actively mean the participation of the patients and their relatives. Whenever we practice, we must have the patients and relatives on board. When I talk to my patients, I talk to them as if I'm talking to a surgical colleague, as if I'm talking to a junior surgeon or a resident. They must understand what I want to do with them or their body or their disease. So that is one thing that I take it very personally. At the same time, I also try to educate the patient's relatives very, very clearly. I lay out all the complications and the possibilities that can come out of the surgical procedure and then make them understand what we are going to do together. So I think those are the things that I always teach my residents. If there are some junior surgeons listening to us right now, I'm sure senior surgeons are experts of that, so I don't mean to teach them anything. And then when I say teamwork, the most important part of the teamwork here are the surgeons. The reason for saying that is I have very, very low threshold for cross-expertise referral. Any cases that I'm not confident about, any cases that even if I'm confident, if I know that one of my other colleagues are doing that procedure in a better way, or if he or she possesses the better skills, I always upfront tell my patients that Dr. A or B or YZ can do this procedure far better than me. I would like to refer you to that person. I think this is something that we lack in our profession, that we must always admit our weakness and we must be, with honor, introduce our friends who actually possess better skills in their procedure to our patients. That is what I always do. That is what I want my residents to learn from me. So when I say teamwork, a surgical teamwork, cross-referral, it is part of the teamwork. Knowing your patients and attendants and talking to them very well, I think is very important part of our practice. I know we all will go on to be a surgeon one day. I mean the residents. I know they will acquire the trade of surgery, but being a good human being, trying to understand that and practice that on daily basis is a little difficult, but I think that will make the difference among ourselves. So I think I'm very happy that I could be at least physically present at this August gathering. I could hear all your citations. I'm very excited that at one given point in time, be it in present position or even otherwise later, I would like to physically attend one of your international conferences and add any value to your organization if I can. If not, I'll be more than happy to come participate and learn for myself. And we also have a small surgical society in our country. And I would like to introduce my friends to your association and see how we could work together and learn from each other. You all teach us the trade of surgery, and we will teach you how to be humble and simple and doing more with less. Because as Dr. Raghu partly said, we probably are the experts of doing more with less. I've done laparoscopic surgeries, laparoscopic cholecystectomies, and laparoscopic appendectomies in remote parts of the country, where we just hold a bag in, and then my anesthesia team will give 20 minutes of anesthesia, and I take the gallbladder out. I've taken 25 gallbladders in about 16 hours. And then my other pleasure is endoscopic and laparoscopic surgery. So I still have a lot of passion for my TURPs, PCNLs, and ERCPs. So that is taking me back to the hospital on a regular basis on every weekend. So as a surgeon, that is something that is already ingrained in our mindset. So as Dr. Raghu rightly said, yes, I'm in politics right now, but this is a temporary timeout from my main profession, that is my surgery. And right now in governance, we are seeking evidence for whatever we do. We do not do what is politically popular, but what is really required for the country. So Dr. Tandi, the pediatrician who is the foreign minister now, Ms. Dichen, who is the public health specialist, who is the health minister now. We also have a public health specialist as the finance minister currently. So we are a good health team that is governing the country. So we would like to be assured, we are ensuring that that politics be professionalized in the country, so that the trust between public and politicians will be, I would say, rephrased in our country, so that countries around the world can copy this. We are very, very excited with this, to professionalize politics. So with this, since you all have had a long day, I'm sure you will have many more events to come up, as Dr. Raghu rightly said, over the next couple of days. I would like to take this opportunity to wish all of you the very best of everything. And when COVID-19 clears, I would also like to invite whoever is interested to visit us, see our place. We are close neighbors, but you would like to share some experience, spend some time with us, show us some procedures, we'll be more than happy to invite you to Bhutan. So thank you very much, and good night to everyone.
Thank you, sir.